Welcome to the third malpractice case in this program. I'm Denise Chamblee, and I'm a pediatric ophthalmologist. I hope this case demonstrates the role of the office staff in helping patients and avoiding poor outcomes. Title of this talk, It's More Than Just Loss of Vision. Our patient is a 52-year-old gentleman who had had several episodes of intermittent vision loss. And what happened was that he would lose vision for a few minutes at a time and had quite a lot of these episodes recently. It had been over the past 6 weeks or so where he had had 8 or 9 of these episodes. And the ophthalmologist made the correct diagnosis. The diagnosis was amaurosis, or a transient ischemic attack. And what happens in this particular condition is that a piece of material will block the blood vessel and prevent oxygen from getting to the intended location. Well, this can occur obviously not just in the eye, but in other parts of the body too. So the doctor was appropriately concerned that this same event might occur, say, in the brain and cause stroke. So the ophthalmologist said, hey, I'm really concerned about this. I really need you to see your regular doctor, your primary care doctor, within the next 2 weeks, because we need to do some more tests on you to make sure that this doesn't affect other places in your body. And a letter was written by the ophthalmologist to the primary care doctor saying, I'm really concerned about this. Please make sure that this patient is tested so that we don't have something else happen other than the eyes. And the ophthalmologist told the patient, I am really, really concerned about you. This can be a really serious thing, and I need you to make sure that if you have these symptoms again, you call us right away. Well, the patient continued to have these episodes of vision loss, and good heaven, he had some of these while he was driving. But he still didn't call. He didn't tell anybody that he had these symptoms, and he particularly didn't tell anybody that he had them when he was driving. And unfortunately, he ended up with a stroke, and that left him permanently disabled. So what could we have done better? Well, the diagnosis was made properly. The treatment as far as ordering more tests was done correctly, but at least the patient felt like the urgency of this situation was not stressed. And in fact, experts felt that with a patient who'd had so many episodes of intermittent vision loss, that this really should have been taken care of within the next 1 to 2 days. In other words, the patient probably should have had further testing within the next couple of days, not within the next couple of weeks. So we're going to talk about that just a little bit more in a minute. And also I want to talk to you about non-compliant patients in general. I'm sure every single one of you listening to this has had these. And again, how we treat patients like family and friends. So this is a form that you can find on the OMIC website. And I've come to really love this form for a couple of reasons. So in this case, we can use this form and we can indicate that this is an urgent situation. We really expect you to see your primary care doctor within the next 24 to 48 hours because this testing is really, really important, and it may affect you in a bad way if we don't get this done quickly. We also have a place here where we can write the reason for the referral. And so if you write on there, for example, in this case, we're concerned that you might have a stroke if we don't have these issues taken care of and tested for, then that may get the patient's attention more. Also, obviously, if the patient takes this form home, family members see it, then you get a little bit more buy-in about what's gone wrong and why there's a timely need for further testing or further care. And then also, we generally have this patient in duplicate, so we put a copy in the chart, and then we give a copy to the patient. So now everybody knows it's clear to the patient, it's clear to the chart, it's clear to the family, hey, this is what was said, and this is what we're hoping for. Now, on the issue of noncompliance, I have this cartoon here, do you solemnly swear to listen to my advice, which doesn't seem to be always the case. but we do all have plenty of non-compliant patients. Now, whether they're non-compliant by just not showing up for a patient, they don't take their drops, or they don't report that they're continuing to have symptoms, any of these count, and I'm sure all of you in this room can think of many more types of non-compliance that we see. So again, in this case, the patient had symptoms while he was driving, and he didn't even call. Not a whole lot we can do about that, but again, if we use that form, then at least it's documented that we've told him that this could be a really serious issue. The other issue with noncompliance is just patients not showing up. So they may not think that that's a form of noncompliance because they may not understand that not showing up for your appointment can cause loss of vision or some serious eye problem or health problem in general. And we always want to make sure that we identify these problems and educate the patients and let them know, hey, this is something that could be an issue for you down the road. Please give us a call and reschedule that needed appointment. In our office, we always try to make sure that the patient gets another appointment at checkout because that's our way of tracking them. If we're relying on them to call us back to get an appointment and their condition deteriorates, that's our way of checking to make sure that we send them a letter. But the point is really, as long as you have some way of contacting the patient, if they haven't come back in the appropriate time frame, that you have a way of informing them that this could be a serious condition and the consequences of that decision. So again, we always want to treat patients like family and friends and treat family and friends like patients. So, for example, in this case, what if this 52-year-old who has had this intermittent vision loss is kind of nonchalant about going for this testing? Well, if we think, that guy could be my brother, my father, somebody in my family, we're going to probably stop and say, well, this is something that I would want him seen sooner. I'm concerned about this. I want to make sure that he gets in for testing. And so maybe we try to schedule the patient their appointment with their primary care doctor, and the primary care doctor says, well, we don't have any places to see him for another 2 or 3 weeks. Well, if we're thinking about that this patient could have a serious problem like a stroke, we might push them or go say to the doctor, I'm really concerned about this because this patient has a serious problem and I can't get him in to the primary care doctor for a couple of weeks, and you were concerned that this needed to be seen in the next couple of days. So your contribution as a staff member to someone like this patient is huge. Now, in this particular case, the appointment schedulers did a fantastic job. They got this patient in that day. So they recognized that intermittent vision loss, multiple episodes of this, was something that needed to be seen right away, and they got the patient into the ophthalmologist. Probably we could have done a better job at helping the patient understand the urgency of getting these tests once they had seen the doctor. Also, in this particular case, the letter was sent to the primary care doctor, but the primary care doctor said that they never actually got the letter. So maybe that was because we didn't pay attention to the details. Maybe the address for the primary care doctor was not correct. Maybe there was an issue with getting the mail out in time. Who knows? But there can be a lot of details that most of you can pay attention to that might have facilitated this patient getting to the doctor. Also, like we talked about, that form that we gave that allows better communication with the family and with the patient about our expectations. Noncompliance, everyone in the office is dealing with, whether you're a technician, you're at the front desk, or you're a telephone operator. We know that patients sometimes are not complying with our recommendation. So every person in the office has a contribution with helping to help patients understand why their noncompliance might lead them to a bad outcome. So it takes a team. It's not about the doctor always just taking care of the patient. Obviously, staff is extremely important. they're important, and you all are important in helping us evaluate these patients, educate them, and really just take good care of them. I hope this case was helpful to you, your office staff, and for our patients. So please forward any questions that you might have to riskmanagement@omic.com.